everyone, and welcome to today's Public Health Ontario presentation on factors that promote program sustainability, a deep dive. My name is Monica Nunez, and I'm a knowledge exchange specialist at PHO, and I have the pleasure of moderating today's session. Before we start with today's presentation, I'll mention a few housekeeping items. First, Zoom allows attendees to have the ability to customize their own view. You can do so in the right-hand corner of your own screen. Please use the chat pod if you have questions during the session. And although we'll save responses to questions until the end of the presentation, the chat pod has been enabled to encourage interactivity during the session. After the presentation, you'll be able to participate in the conversation by using the raise a hand feature. You can unmute yourself, or you can even come on video. Now, if at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. It's now my pleasure to introduce the speaker for today's presentation, Andrea Bodkin. Andrea has worked in health promotion and public health since 2003 with a focus on program design and implementation, effective collaboration, and learning design. As Senior Program Specialist in Health Promotion with Public Health Ontario, Andrea brings her enthusiasm and expertise for planning in all forms, evaluation, community engagement, partnership development, and facilitation to public health units across Ontario. Andrea holds a master's degree in public health with specialty in health promotion from Deakin University in Melbourne, Australia. Welcome, Andrea, and thanks so much for being here.
Thank you, Monica. Thanks so much for moderating, and thanks for the introduction. As Monica mentioned, my name is Andrea Bodkin. I'm a Senior Program Specialist here at Public Health Ontario, and I identify as a white cisgendered settler. Today, I am speaking to you actually from our office in downtown Toronto, but usually I am working from my home location, which is right beside the Don Valley and the Don River in Toronto, probably most famous for the Don Valley Parkway, but the Don Valley itself has been home to Indigenous people for over 10,000 years, beginning with small groups of nomadic hunters, and then the Wendat and the Haudenosaunee moved in. After those tribes withdrew south, the Mississaugas of the Credit settled in the Don Valley, and finally the Mississaugas withdrew to a reservation near Hagersville, Ontario. And I find that interesting because a lot of the times we talk about the Mississaugas of the Credit, and it's very easy to think that band is located in Mississauga, but they're actually now in Hagersville. And the band still exists today. They have over 2,500 members, many of them living off reserve. And though they've had several hundred years of change, of occupation of their traditional territory, a loss of culture, the Mississaugas of the Credit have endured, and they continue to adapt and grow into a resilient First Nation community. As I mentioned, I'm of settler heritage. 3 of my 4 grandparents' families settled in southwestern Ontario in the 19th century, so in the 1800s, and many of my ancestors cleared the land of trees and established farms. We have some very detailed family history written down by my ancestors, but nowhere in that documentation is there a mention of any working with or associating with First Nations people. There's no record of how my ancestors gained that land. And so one of the reasons it's really important to me to position myself as a settler and to do land acknowledgements, such as this one in today's webinar, is because I recognize that the many privileges that I have. I'm educated, I have safe housing, I have full-time employment, I feel safe in my community. My list of privileges is endless, and I have those privileges as a result of the actions that my ancestors took. And I recognize that it's part of my role in today's hopefully environment of reconciliation to not only acknowledge the land that I'm on, but to think carefully about why I am doing that and what it is that I want to accomplish. So before I move into the rest of the presentation, I also really need to acknowledge Sean Hakimi, who is the second author on the published paper that this webinar series is based on. Sean is currently pursuing doctoral studies at Queen's University, so he's unable to be here, but this paper would not have happened without Sean Hakimi, so great big thanks to him. And thank you all so much for attending. It's great to have so much interest in this paper. So, why we're here today. So many of you commented on the evaluation in the very first webinar way back in June that you would like to explore the 14 factors for health promotion program sustainability a little bit more deeply. So that's what we're hoping to do as a result of this webinar. So I'm going to give you just a teensy bit of background about the paper. I'm going to dive into those 14 factors. We're going to do a little bit of a Q&A at the end. Now, this is a pretty content heavy webinar, so buckle up, get ready for that. And I'm not going to be sharing the slides from today's presentations. You'll see why in a moment. It's mostly just pictures, but you all would have received yesterday an extraordinarily detailed handout, which has all of the information that I'm going to be talking about today and even a little bit more. So I set up your handout in a table format so that the factor that I'm talking about is in the left-hand column. In the middle column, I've given you a bit of detail about what that factor looks like and some of the barriers and the facilitators associated with that factor. And then in the right-hand column, I have a column called strategies. And those are some things that you could actually implement, preferably in your program planning processes, but certainly in your sustainability planning processes to help to sustain your program. In the handout, I have tier 1 and tier 2 factors, which I'll go into it in just a little bit. So you've got a whole pile of information there. So before we dive in too much further, Lydia has a polling question for us. I'm just really curious how many of you attended the webinar that we had in June, or if you watched the recording, or if you read the journal article, and you can click more than one, I think. Okay, so we have a lot of folks for whom this content is brand new. So I did kind of assume that folks would have watched or attended the first webinar. So I'm not going to go into a whole lot of background, but you're certainly able to take a look at that after this webinar if you would like more details, in particular around the methodology, because I'm not going to be talking about that too much. Okay. So, tiny overview of the process. Like I mentioned, there's lots of places you can go if you are curious about learning a little bit more about what it is that we did. So as Monica mentioned in the intro, I've been working in health promotion and public health for, I need to do the math, about 16 years or so. And many of you who have been working in this field for any length of time are very familiar with this phenomena. We get a grant. We get a pilot program funded, we plan and we implement and we evaluate, and then the program funding ends and poof, the program disappears. And along with the program disappearing, all of the benefits of the program disappear, all of the collateral assets that were involved with the program disappear, like connections to community and relationships with partners, a whole lot disappears. And I have been through this in my career. I've just seen it so many times. And I started to get really curious about how we could embed thinking about sustainability into the planning of our health promotion programs. So rather than thinking about sustainability from the end, at the end of our pilot or the end of our funding period, can we actually build our programs to be more sustainable? So we did a systematic review to look at barriers and facilitators that can influence the sustainability. We looked at published literature and we looked at gray literature as well. And we included 16 papers in the final study. 6 of them were reviews, such as literature reviews and systematic reviews. There were 7 primary studies, 2 workbooks, and 1 sustainability framework. So I think it's probably a good idea to tell you what sustainability is for the purposes of the paper and the purposes of this webinar and this piece of work. And really what we're talking about is continuing a program within an organizational structure or some kind of structure after the initial program funding ends. So that's what we're talking about. We're not talking about environmental sustainability or sustainability of a health system or of an organization or anything like that. We're really looking at the program itself. How can we really sustain that? And we had basically 3 categories of findings in our paper. The first group were definitions of sustainability, and all of the papers that we included defined sustainability. It was an inclusion criteria, so of course they did. But most of those papers talked about how rare it was to see sustainability defined. And if people are actually trying to sustain their programs, it's probably a good idea for them to have a sense of what sustainability means for their context. And that means defining it. So in the review, we found a number of different definitions of sustainability. And one of the things that we really recommend is that for those of you who are trying to sustain a program, that you sit down with your partners and stakeholders and try to hammer out precisely what is it you are trying to sustain and what does sustainability look like for the context of your program. The second thing we found was sustainability frameworks. Now, of course, as a health promoter who works in public health, I love theories and models and frameworks. They are fantastic. And I certainly recommend using a framework not only to plan your program and to evaluate your program, but also to plan for sustainability. And in the paper, I think we found about 13 unique sustainability frameworks. So there were certainly a number that you can look at and some that you can adapt as well. And our third finding, which is really the big meaty one, are the factors that promote program sustainability. And that's what we're going to go into in just a second. So we found 83 barriers and 191 facilitators in the papers that we included, and we categorized them into 14 categories. We're calling them factors. 9 of those came from an a priori framework, Shell et al. 2013, which formed the basis for the PSAT, the Program Sustainability Assessment Tool, which you'll find very easily if you just Google that. Now, there were quite a few barriers and facilitators that didn't fit into those 9 Shell categories. So we developed 5 additional categories. And on the slide, you can see the ones that are starred are the ones that we developed. Then what we wanted to get a sense of is we came up with 14 altogether. And on this slide, you can see tier 1 factors are in column 1, the left-hand column, and tier 2 are in the right-hand column. What we wanted to do was get a sense of, are some of these more important than others? If you need to prioritize, if you need to really put all your eggs in one basket because you only have so much capacity and so many resources, where is it that you should put your effort? So in order to come up with an answer for that, we did a little bit more analysis. So we analyzed the 14 factors based on frequency. So the number of times the barrier or facilitator appeared in our data extraction. Importance. So when the authors of a paper said, hey, this particular barrier was really important, or this particular facilitator really seemed to be very important for sustainability. And then the last thing that we looked at is what we called relevance. What we did is we went through PHO's health promotion program planning model and workbook and highlighted every time there was something in the workbook that came up in the literature. And that allowed us to sort of rank or rate these 14 factors, and we put them into 3 tiers. The first tiers are right up on your screen for you. So a couple things to just mention. We've made these 14 distinct factors, but the reality is that they're all intertwined. And you can see in your handout in the key features column, what I've done is I've actually indicated what factors each factor may be related to. And I'm going to go into that a little bit. The other thing is that though our analysis helped us to identify which factors might be most critical, your program and your context may be quite different. So we might have said, and we have said, that organizational capacity and partnerships are probably two of the most important factors, but for your particular circumstances, there might be something different. So please do keep that in mind. So because there are so many factors and there's very limited time, I can't believe I've been talking for so many minutes already. What I wanted to do was get a sense of which ones are most important to you. So we're going to do something very fun called Annotate. And what you should be able to do at the top of your screen is there should be a View Options button. And when you click on that, there's a feature called Annotate, and you should get a toolbar that comes up at the top of your screen. And we're going to use a couple of things. We're going to use the stamp feature. And what I'm going to ask you to do, and I'm just going to demonstrate, is give a star to the factors that you really want me to talk about today, probably the ones that are most challenging for you. And then give a little heart to some of the ones that you think, these are no problem. I totally get what this means. I totally understand it. And I don't need Andrea to spend a whole lot of time talking about it. So please let us know if you're having trouble finding any of those features. I'm seeing hearts and stars all over the place. This is very tremendously exciting. I'm going to take a couple of notes so that I can make sure that I spend adequate time talking about the factors that are important to you. Wow, and I might get my handy dandy moderator here to also help me out with taking a look at all of this incredible, wow.
Hi, Andrea. Yeah, I definitely see a lot of representation across the factors, but there's a lot of interest going to program evaluation, capacity building, socioeconomic, political factors, I think are what I'm seeing is the top three. Okay. People are feeling pretty good about partnerships, though.
Yeah, there's a lot of love for partnerships today. That's kind of nice.
Mm-hmm. And then an interesting, well, yeah, I would say those are the top three: program evaluation, capacity building, socioeconomic, political factors. And then interesting split for organizational capacity. So it looks like that one could go either way.
Okay, that's great. Thank you so much for doing that, everybody. This is the first time I've used this Annotate feature in Zoom that my colleague Dan Johnson here at PHO introduced me to. So this is massively exciting. Okay, so I am going to just change the security session settings here so you will no longer be able to annotate, and I'm going to move on, hopefully. Oh, I need to clear some stuff apparently. Hang on. Hang on, folks. Just give me 2 seconds. I just need to go back and clear this. Annotate. Clear. Okay, sorry about that, folks. And let me just back up. Sorry, I have a whole bunch of toolbars coming up. Lydia, I'm having some trouble navigating in my slides. How do I, oh, never mind, I got it. Okay, thanks so much, everybody, for your participation there. And next time I'm gonna remember to clear all of your wonderful stamps. Okay, so as I mentioned, the inspiration for this webinar really came from the evaluation of the first webinar, where a lot of you said, oh, it was really nice to have the background of the paper and stuff, but what we really want to know is get a bit more of a sense of what's incorporated in the 14 factors. So that's really what I've tried to do today. So I'm going to dive into some of them, and I'm going to try to pay the most attention to the 4 that you all helped to identify, and I'll certainly go into some of the others as well, and then your handout will hopefully help too. So organizational capacity. So this was the most highly coded factor in terms of frequency and in terms of importance. So from that, we can take away that the factor heavily influences program sustainability. Now, what it refers to is having the resources needed to effectively manage the program and its activities. So this sounds a little bit obvious, but if you think about it, you'll realize that if your organization or the group of organizations implementing the program doesn't have adequate capacity to plan, deliver, implement, evaluate the program, it's going to be pretty difficult for that organization or group of organizations to sustain it. And there's a lot of stuff wrapped up in this factor. I think there were 28 categories of barriers and facilitators, but some of the really big ones had to do with staffing. So lack of qualified staff and difficulty in recruiting and retaining staff and high staff turnover, those were all barriers. Facilitators were things like leadership and management support, strong buy-in from senior management, identifying, engaging, and developing internal leaders, having organizational commitment. So the staff is aware of the program, of the mission and the vision and the values of the program and of the organization. Leaders are committed. And a couple that I found really interesting, that there's an ability for the organization to mobilize resources. So you have resources and you're able to actually mobilize them. Perhaps you need to reprioritize or move some folks around or leverage some partners' capacities or something like that. But you can mobilize things such as time, human resources, and finances. And then organizational structure and governance. That can be a barrier or it can be a facilitator. So some strategies that might be helpful here is, and this again sounds very obvious, but ensure that the organization has the capacity to fully implement and sustain their program prior to implementing the program. And that can include things like staffing, leadership, and management support. So the next factor I'm not going to spend a whole lot of time on because our partnership's got a lot of love on our little annotate exercise there. But this factor is really important. It was the second highest rated one. It was also mentioned a lot in the Public Health Ontario's Health Promotion Program Planning Framework. And it was mentioned in every single paper included in our study. And I really found that this factor is related to all of the other factors. So engaging partners and stakeholders and communities, and each of those factors can promote sustainability. So for example, you could have a network of partners that could include stakeholders and communities and the people involved in your program. And that network can help you to advocate for sustainability. It can help to provide additional resources. It can bring specific skills and knowledge to the partnership and to the program. It can support service delivery. And then from a community engagement perspective, really working with the community that you want to try to reach with that program to develop it. It's going to increase their sense of ownership and it's going to increase their participation in the program, which can lead to increased sustainability later on. So some strategies for effective partnerships include engaging with partners who have a shared vision and a similar mission, dividing tasks between partners using participatory approaches, because it's not just having partners involved, it's having them involved meaningfully in every layer of the program, and building sustainability into partnership agreements. So maybe think when you're developing partnership agreements, not just think about the original term of the program, so maybe that's the funding term, but beyond, and how can you engage that particular stakeholder or partner in sustainability. So the next factor is strategic planning. And this one's a little interesting because when I look at this definition, it's the process of defining program direction, goals, and strategies. To me, that sounds a little bit more like a definition for program planning than strategic planning. But really, it's a potato, tomato situation. Doesn't really matter what type of planning you're doing, whether it's strategic or program or evaluation or sustainability. What's important here is that you're actually planning. You're purposefully considering if the program can be integrated into your organization and the organizational structures. You're planning all of that right from the outset. There is also a lot of barriers and facilitators related to sustainability planning itself that we put in this factor. So one of the things that we talked about is allocating funds for sustainability planning, allocating staff resources for sustainability planning, and regularly assessing your process. So some of the strategies for this factor are planning the health promotion program and its associated activities around an established theory or framework. Already told you that I love those things. Assessing the environment and the local context in which the program is going to be implemented. So you could do something like a SWOT analysis or do a situational assessment. Make sure that the program goals and activities are matched to what the community needs and what the context is calling out for, and plan adequately every step of the way. So the next factor is funding. Now, oftentimes, when we think about sustainability, we think about sustainability and funding being exactly the same thing. And there's a lot more to sustainability than just funding, but also if you take the funding away, it can really hamper some organizations' efforts to sustain the program. So the definition of this one is to make long-term plans based on a stable funding environment. Now, if I could just wave my magic wand and wish stable funding for you all, that would be very helpful. But some of the things that you can also do is prioritize funding stability by dedicating resources and staffing to it and having multiple strategies to obtain funds. So think about multiple funders, think about all of those kinds of things, and right from the very beginning. One of the things that I often think about is organizations and governments and all sorts of folks have lists of values and priorities and goals and mandates and all of that good juicy stuff. What you really know what the priorities of that particular body of folks, whether it's an organization or otherwise, you know what their priorities are when you look at their budget. And if you want to prioritize sustainability, you need to put it into your budget. Just like we say, you know, you should be setting aside 10 to 20% of your overall budget for evaluation. You should be setting some aside for sustainability as well. It's not something that funds itself. It does not happen by accident. So this is one of my favorite factors. Maybe because it was one of the ones that we developed over the course of this paper. It was really interesting that so much of the literature talked about things related to fit and alignment, and it wasn't in the a priori framework that we used, Shell et al. 2013. So what we're talking about here is alignment between the program and the organization's mandate and core business, alignment between the program and community needs and priorities and opinions, and also aligning the program with something that can readily fit into existing tasks and procedures and can contribute to the organization itself. And if you think about it, I mean, I've worked in organizations, and probably many of you have as well, where sometimes we do anything for funding, right? We're like, okay, I'll do anything you want for this $15,000 or this $600,000, depending on what your organization is like. And sometimes it's easy to forget about the purpose and the mandate and the goal and the mission and the vision of your organization. And when organizations take on programs that don't align with those things, or if there's a mismatch between that and what it is the community is asking for, it's going to impact your program. You're going to have trouble implementing it, let alone sustaining it. So that fit and alignment piece is really important. Okay, this is one of the ones you really wanted to talk about, so let's dive into program evaluation. So this was in the Shell framework, and the definition of this is monitoring and evaluating process and outcome data associated with program activity. So that sounds pretty average, right? That sounds like what program evaluation should be. But what's really juicy about this one is that it really seems to come down to resources. Just like what I said a minute ago, you can tell what an organization's priorities are when you look at its budget. And program evaluation is really important. Think about it. I mean, if you can't measure the impact and the success of your program, and you can't communicate that adequately to your funders and partners in the community, how are you going to be able to sustain it? Evaluation is a key component to being able to show people what is possible as a result of your program, making the case for sustaining it. So one of the really important things is around data collection and analysis. So having the appropriate resources to collect sound data and analyze it, that was found to be really important for sustainability. And a possible reason for this is that it helps to determine whether the program's being carried out effectively and if it's worth sustaining. Like I said, you need to be able to show that the program is having impact. Having lack of proper evaluation methods was a barrier to sustainability. Again, not rocket science. If you can't show the worth and the impact of your program, it's going to be hard to justify the sustainability for it. So it's difficult to demonstrate the value of the program to stakeholders and funders and key individuals if you don't have the data from your program. And the degree to which the program could be evaluated for implementation and for effectiveness, and whether the findings were reported back to program staff and then used to align program delivery in the field impacted sustainability, because adapting a program to objective data ensured that it was relevant and met the needs of its recipients. So we're talking about quality improvement there. We're talking about quality assessment, using your evaluation data in real time. So some of the strategies that we recommend around evaluation is having good data collection and analysis, and routinely planning for evaluations throughout the program life cycle. Having appropriate resources, so budget it in terms of money and staff time to ensure sound data collection and analysis, because that can help you objectively demonstrate to stakeholders and funders what impact the program is having and that it should continue. So you need to give ample attention to how you're going to evaluate the program and evaluate the sustainability of the program, as well as making sure you have the appropriate tools to collect and analyze data. You might have to actually prioritize that. So I hope that that is helpful. So here's another one you were all very interested in, and this again is a new factor, and it's called capacity building. And we define it as the development of sustainable skills, organizational structures, and commitment with a focus on prolonging the program. So this particular factor is linked to organizational capacity. In particular, it can help with staffing. You'll remember with organizational capacity, one of the biggest barriers and facilitators was around staffing. So you can build the capacity of your staff. You can direct effort towards staff training and workforce development, skill development related to the program, and all of those things can help to improve sustainability. So some of the strategies included in capacity building here are to provide program staff with the necessary skills and knowledge to implement the program, ongoing technical assistance to support them as they implement the program, educational opportunities that can further their understanding of the issue being addressed through the program, because that improves buy-in and quality of service delivery. Providing ongoing skills and professional development opportunities improves staff retention, which is important for that organizational capacity factor. And it can help during times of uncertainty by providing necessary supports for staff and for participants. So while really in the research, we were looking at capacity building from an organizational and staffing perspective, you could certainly think about the capacity of the program participants, of the community around the program, and also of your partners and stakeholders involved. Okay, this is the last tier 1 factor, and it is champion. And this was another surprise to me, because every single paper that we included in the study talked about the importance of having a champion. And it was not included in the shell at all framework that we used for the a priori framework. So a program champion is an influential individual, or maybe a few individuals, who acts as an advocate for the program. They often enthusiastically advocate for the needs of the program, particularly to help secure resources for implementation and for sustainability. Sometimes your champion can be a powerful person in a leadership position. It could be a role model. It could be a partner or a stakeholder. Maybe it's a community group or a group of folks that are actually accessing the program or participating in. And this factor is linked to many of the others. It's linked to the partnership factor because some of your partners may be champions. It can also be linked to evaluation and to communication because that champion might be a spokesperson and might be able to clearly communicate on behalf of your program. So a champion at the executive level was found to be useful for enhancing sustainability because they're in a high enough position to advocate for continuation. And there was even actually one case of a program failure that was attributed to a lack of a champion. So the example that I always think of here, not from the included literature, but just from some of the things that I've been working on is the Healthy Kids Community Challenge, which many of you may have been involved in a few years ago. It was a very large program funded by the Ministry of Health. And part of the application process for that program funding was the identification of a champion or more than one champion. And most of them were involved somehow at the municipal government level. So maybe they were a mayor, maybe they were a city councilor, maybe they were someone else influential. And identifying that person right from the very beginning can help to impact sustainability. Okay, I'm just looking at the time. And I think communications was another one that folks were a little bit interested in. So I don't have individual slides for the rest of the factors in tier 2, but I certainly have a little bit, a few things that I can certainly talk about. And I know we definitely wanted to get at the socioeconomic factors as well. So I did really want to touch on communications because it is so linked to many of the other things. Like I just mentioned, it's linked to champion, it's linked to program evaluation, it's linked to fit and alignment, it's linked to funding. There is a really important role around partnerships, about regular and authentic communication with partners and program participants in the community that have to do with communications. It can help to increase community awareness on the issue, which can build the groundwork for sustaining the program. You might want to think about marketing strategies, about social media, basically getting the word out, getting the word in, so amongst your partners, stakeholders, champions, program participants, and then getting the word out into the broader community. So let's take a little peek at socioeconomic here. So this was a new factor, and you can see it's actually it's the very last factor listed in tier 2. But again, that doesn't mean that it might not be important for your particular program circumstances. So there is a factor called political support, but socioeconomic and political factors is not quite the same. Political support is actually having the internal and external political environment that influences program funding. So basically what's happening around you is conducive. Socioeconomic and political factors are a little bit different because this refers to things outside of our control. So a great example might be the pandemic. We had no idea that that was going to happen. Well, many of us did not know that that was going to happen when it happened, to the severity that it happened. Here we are 18 months in and it's not quite over yet. So those are things you can't necessarily plan for. You don't necessarily know are going to happen, but they're certainly going to impact the program. Another example could be a change in government. Another example is short budget cycles. Sometimes it's hard really to show the long-term success of our programs, especially in health promotion, where it could be, 8 or 10 or 15 years to show the impacts of our program, and funding cycles are much shorter than that. There also could be internal political pressures, the time that it takes to develop a policy. This is a really interesting one because, as you all know, developing a policy could take 20 or 25 years. You need to keep the momentum going for all of that time to sustain that buy-in and sustain the work on the policy. And there could also be competing issues. So perhaps something like poverty or unemployment, or there could also be something within the public eye that is seen as more important than tackling something such as poverty and unemployment. So I feel like I just talked in a whole rush for about 35 minutes. I can certainly talk a little bit more about some of the factors if you would like to, but I think we can probably go to Q&A, Monica. Monica, I might have you start the ball rolling to see if you had any questions before we get to the ones in the chat.
You know, Andrea, I was engaged by the questions in the chat pod, and there's a few fantastic ones already there, and I kind of have a feeling that there'll be more on their way. So
awesome. Let's just go right to that then.
Yeah, let's go right into them. So from Sam, she's wondering, in terms of sustainability, does program fidelity come into play when we speak to sustainability? And as a follow-up, do you need to define what needs to be sustained after program implementation, i.e. not everything might need to be sustained after program implementation?
Totally. What an amazing question. I'm so glad you went right to that one, Monica. So one of the factors that we found is called program implementation. It's the second one in tier 2. And I think while program implementation and program fidelity might not be precisely the same thing, they're certainly very similar. And it just makes sense that if you didn't implement the program fully, it's going to be pretty difficult to sustain it. Whether that is something because of what's happened in the socioeconomic or political environment, or whether it's something that happened with your program. So there is definitely a relationship between program fidelity, program adaptation, and the sustainability of the program. And then your second part of your question, Sam, you totally hit the nail right on the head. Yes, you absolutely need to define what it is that you want to sustain, and you need to think really critically about what needs to be sustained. Because I think a lot of the times we think that everything needs to be sustained. Oh, we want to sustain the whole darn thing. And maybe that's completely fine. Maybe your program doesn't need to be sustained at all. Maybe it can't be for some reason, but maybe there are just parts of the program that want to be sustained. So I'm going to attempt to go back to an earlier slide if I can figure it out. Let me see. Okay, here we go. I want to go back to the definition of sustainability slide, if you'll bear with me for a second. Because this gives you a sense of what can actually be sustained. So this definition of sustainability comes from Shediac, Rizkala, and Bone, and it thinks about sustainability at 3 levels. So maintaining the individual benefits. So did the individuals within the program make behavior changes? Did they lose weight? Did they quit smoking? Did their basic income increase? So maintaining those health benefits could be one of the things that you could sustain. You might continue some or all of the program activities within the organization. You might sustain the capacity of the community so that they continue the program. Another thing that we often think about from a sustainability perspective is the partnerships that were actually established. And in some cases, it's the partnership that is sustained, not the program itself. We're not certain parts of the operation or certain parts of the program, but actually the people who got around the table working together, they continued that. So you certainly need to think about what is it that you want to sustain. And the PSAT tool that I mentioned briefly, the Program Sustainability Assessment Tool, there are the 9 factors that were included in our review, and there are worksheets for each of them. And it can kind of help you take a look at what is it that are some of the strengths of the program that maybe you want to take a look at sustaining. I hope that answers your question, Sam.
Thanks, Andrea. I think that I'm going to jump to Ian's question because I think it builds off your response possibly. But before I do that, I just want to invite anyone else that has questions to type them into the chat pod, or you can raise your hand using the feature at the bottom of your screen. You're welcome to just, once we call on you, you're welcome to come off video or unmute yourself if that's something that's comfortable for you. Otherwise, the chat pod's always there for you. So here's a question from Ian. When you budget for sustainability, what specific elements do you suggest? So does that connect back to the definition and those 3 levels, or? What are
Yeah,
your thoughts on that?
I think it definitely would, because I think that you, again, need to have an idea of what it is that you're trying to sustain, because sustaining individual impacts would be very different budgetarily from sustaining a program, which would be different from sustaining a partnership. So I think that is definitely a part of it. And then in terms of how else, I think maybe part of your question, Ian, and feel free to come off mute if you'd like to expand on this, is okay, so if I'm going to dedicate resources to getting sustainable to sustaining my program, what would the activities that I would budget for be? I think maybe that's part of your question. And I think that does go back to the definition, like Monica suggested. And I think it would really depend on the particular context of your program. And I think it might have to do with some of the barriers that you might have to sustaining the program. And maybe that is where you need to pay attention to. So let's just say, for example, you got a 3-year grant from a foundation, and there's no possibility of it getting extended funding with that foundation. And let's just say, for fun, that part of the criteria for getting that foundation grant was that you couldn't get any other grants after that from anybody else. I'm completely making this up, but just to give you an example, if you know that going into your sustainability planning, you need to figure out, well, if we can't get funding from XYZ, how could we do that? And one of the potentials could be through partnerships and stakeholders. So there might be an organization out there whose mandate closely aligns with your program, and maybe they could take the program over, and that's how you get your program sustained. So that could be an example, and I hope that helped, Ian, and please feel free to drop an additional question or come off mute if you would like to.
Yeah, thanks so much for that, Andrea. So interesting. Ian saying thanks. And so interesting to hear about how the factors intersect and how you can leverage one off the other. Speaking of which, Lori Dawn has a question about whether there's a connection between one of the factors and maybe another component of sustainability. She's asked, Lori Dawn's asking, where does dissemination fit? I'm assuming communication.
Yeah, but also probably an evaluation, but maybe also in partnerships, because maybe it's your partners that can help with that dissemination for you. Maybe also in champions for the very same reason. Maybe part of it is strategic planning, because maybe you need to plan for that right from the very beginning. So an example that I have, and I don't have data in terms of if this shows sustainability, but just as an example, one of the things that is very popular right now in evaluation, particular with Indigenous communities right now, is digital storytelling. And if you know that digital stories are going to be the primary focus of your evaluation, those are very particular dissemination strategies, because you're talking about videos, and you might be using TikTok, and you might be using all of that kind of stuff that maybe you really need to plan explicitly for. So I think dissemination probably fits all over the place. Definitely a big role within communication, but also evaluation. And then you can also think about who can disseminate with you, which is where you can bring in your partners and champions. I hope that answers your question, Lori Dawn.
Lori Dawn says, so considering all potential opportunities for dissemination and engagement.
Basically do everything all of the time. That's my helpful advice.
Great. Thanks, Andrea. And thanks, Lori Dawn, for that question. So from Jillian now, what insights or recommendations were there about what happens when a champion no longer is around?
You know, that is a great question. Jillian, I might actually have to go back to the data extraction table and see if I can get that, because there wasn't anything that I pulled out in my notes. One of the things that I found very interesting is that the literature talked about having a champion, but I have seen in my practice, and you have all seen, and I bet this is why you've asked the question, Jillian, what happens when that champion leaves, and then all of a sudden everything crumbles to the ground. So my personal recommendation, I don't know if it holds true in the literature because we didn't specifically look at this, is to think about a group of folks around you. So I think if you were one organization and you had a champion within your organization, or maybe a city councilor or something like that, I don't know that that would cut it, because if that city councilor loses their seat or something like that, everything falls to pieces. But if you have a network, if you have stakeholders, if you have partners, if you have a group of champions, if you have, for instance, if maybe it's a great big partnership between public health, parks and recreation, education, or community health, those are big partners. You can get a bunch of champions from each of those sectors. And also the community. I think there would probably be a higher turnover in community champions. I have no data for that, but just because we all know how busy people are. But I think really the secret there is to have a network of champions. There might be one big champion, but you need to have a whole group of people around you.
That's a really great example. And Aaliyah was commenting to Jillian's comment, as Jillian has seen champions come and go, that you sort of need to do sustainability for champion development.
Yeah.
So it sounds sort of like what you're suggesting in champion recruitment, so making it a bit more broad-based. And then Paul's jumping in to suggest maybe succession planning to ensure you have a champion when other champions.
Yeah, Paul, that's
move on.
amazing. I was just thinking about succession planning. I was thinking about how boards often function, where they have a president and then a vice president. And when the vice president becomes president, the president becomes, ex officio or past president. And then the secretary moves up to vice, so you have that succession planning right in there. And not necessarily that you need to be that formal, but that it's something that you really need to think about is how do you have strong champion voices, and also making sure that there are others behind them in case there's something that doesn't quite pan out. This could be where you really might want to think about what motivates champions to be champions and what motivates them to stay with the program. This might have a link back to evaluation. If you're really showing that your program has impact and the champion really cares about that impact, then that's going to help them stay involved, right? And the capacity building also might be helpful, because maybe there are things that you could do to support that champion to help them stay motivated and engaged in the program. Maybe there's some training or some skill building. Maybe there's some opportunities. Maybe there's partnering on another kind of program. You champion mine, I champion yours. There could be quite a few things in there.
Thanks, Andrea. And Jillian is also saying thanks to everyone for the tips, and something for them to work on this year.
Great.
So yeah, we still have a few more minutes, I think, for a couple of more questions, but in the meantime, maybe I can pose one to you, Andrea. You had mentioned that it's really hard to predict those socioeconomic political factors, and we know that the pandemic has really shook a lot of programs for sustainability. Are there any factors that you think might be more salient at this time, or is it really dependent on the program and where it's at, or was at prior to this time?
Yeah, I think it would really depend on the program, but what always comes through to me, and if I think back to our little annotate exercise, I think partnerships are really key. And I think that one of the things that we've learned through the course of the pandemic is that we've started working in some circumstances with partners that we have never worked with before. Even if I just think about myself, so part of my role at PHO during the pandemic is I'm helping out with the contact tracing initiative. And we had a number of organizations who were providing staff to us to do a contact follow-up phone calls. And so I got to work with the Department of National Defense and Statistics Canada. I wouldn't have worked with those folks if it wasn't for the pandemic. But now that we've worked together, maybe that there's a way that we can work together in the future. And I think the pandemic has really helped us all think outside of the box a little bit more, and maybe engage with our communities and our participants a little bit more, because sometimes, well, actually quite a lot of the time, what we think our participants need isn't maybe what they need. And I think right now more than ever, they have a sense of what it is that they need.
Yeah, that's really interesting, Andrea, and reassuring, because at least this group on the line has really highlighted during your annotate session that partnerships is something that they're feeling comfortable with. So if we continue to leverage and optimize the benefits from that, it it may help us with our path forward.
Mm.
Sam has provided a comment in the chat box. We found with the PHO UTI program that having an implementation team of 3, for example, including perhaps the champions, would support sustainability and implementation. So we built into the program an implementation team to support implementation, but also sustainability.
Yeah, that's a great comment, Sam, because I think that goes back to what I was talking about with sustainability planning, and that you need to devote the capacity and the resources to that. So having a group of folks who are working on sustainability, it might be the same group of people as implementation, or maybe you have a little bit of crossover. I think that's really fantastic, because when you have those folks, when it's their job or their mandate or their responsibility to secure the future for the program, and you have devoted capacity and resources to that, then they can really help to make that happen. It's a great comment. I love that.
Yeah, wondering from others on the call if they've utilized implementation teams and that have also had a role in helping to foster sustainability.
Yeah.
Putting everybody on the spot.
Absolutely. So maybe and I'm not going to mention names here, but I just got a direct message from someone that I worked with on contact tracing who just sent me a DM to say that couldn't agree more on the partnerships being key. It's great to hear from you. So maybe we'll just wait to see if there's another question or two coming in, but while we're waiting for that, I'm just going to mention that based on your feedback from the first webinar, we have built this out into a series. So today, a deep dive into the factors, and the third webinar on October 27th is going to be a little bit of a learning exchange of folks who have successfully sustained programs after the loss of initial funding. It's going to be a little bit of a panel. I'll have 2 or 3 organizations represented to talk about how they sustained their programs, and then help to draw some links between what they did and the 14 factors. And we'll be sending out information relating to that fairly soonish. So please keep your eye out for that. But also, if you have suggestions, please feel free to make them in the evaluation. And in particular, I would really love to know how you reacted and responded to the handout, if it was useful, or if it wasn't, maybe why not. I'm thinking about maybe making that a broader PHO resource. It was really difficult to come up with a format and figure out how to get all of this incredible information to you in a way that made sense. So if you have questions or comments on the handout, especially on how to improve it, or if it did meet your needs, I would really love to hear from you, because that would be really helpful for me. I'm just putting up the slide with my email address. You can also find me through Twitter. I'm at Andrea Bodkin. You can listen to the podcast that I host, which is called Tenfold. It's about community engagement and public health. You can find that on all major podcast catchers. Thanks, everybody, for being here.
Great. Thanks, Andrea. And as I wrap up this session, just letting you know there's some early kudos for the handout.
Oh, yay!
So thank you, Andrea, so much for presenting today. And I want to thank everyone who joined for today's session and their participation. You can expect to receive the brief and anonymous evaluation survey for today's session. And we love when you complete those, because it really helps us improve our programming. And I know that Lydia has already posted it into the chat pod, so you can access it right from there if you're eager to do so. And thank you. I want to say thank you, and have a wonderful day. Thanks, Andrea.
Thank you. Bye, everyone.
Bye-bye.